Coming up today on LinkedIn News Live, the COVID-19 vaccine is here, but that's just half the battle. We speak with the president and CEO of the CDC Foundation on what needs to get done before we can return to some semblance of normalcy. Plus, should employers mandate vaccines before returning to work? You tell us. All that next. Hello, I'm Caroline Fairchild, and welcome to LinkedIn News Live, where the business conversation begins with you. It's February 24th, and here's a quick look at the top headlines trending right now on LinkedIn. Macy's lost $3.9 billion in sales last year. LVMH buys 50% in Jay-Z's champagne brand, and house prices are skyrocketing. Let's take a deeper look into that story. Low interest rates and lack of inventory are causing property values to skyrocket in cities across the country. Bloomberg reporting that home prices grew 10% from the end of December 2019 to the end of 2020. This topic brought in a ton of conversation on LinkedIn to the platform. We're going to show you just a couple comments from members here in the stream right now to get your take on why house prices are skyrocketing. Kent Tyrell says, working and learning from home, consumers are yearning for more space. Retirees will continue to add to available home housing inventory, but maybe not at the pace for the number of buyers wanting homes. That's from Kent Tyrell. He's a realtor at Coldwell Banker. And then we also have Ann Grace weighing in. She's a realtor from Idaho, saying she's definitely seen a rise in home prices where she is. And she writes, in the last 2 weeks, 2 properties sold for more than $100,000 over asking, closing in less than 1 week, and active on the market for only 24 hours. If you're thinking about selling, she says right now is the time. And to join conversations like these right here on LinkedIn, be sure to check out the news module to the right of your LinkedIn feed. Or if you're in mobile, you can click into that search box. We've been polling professionals on the LinkedIn news page, and we want to hear from you too as well on the stream with the poll that we have for you today. We want to know, should employees be required to take a COVID-19 vaccine before returning to the office? A, yes, B, no, or C, it depends. Let us know in the stream, and we'll lend your thoughts behind your vote as well, and we'll have a conversation about that on today's show. There are currently 2 vaccines available for COVID-19 with a third on the way, and they were both developed as well as authorized with record speed. But getting those vaccines into people's arms is still a monumental challenge. Vaccination efforts are moving along at a relatively fast pace in the US. More than 65 million doses of COVID-19 vaccine have been administered nationally, but a lot of work still needs to be done. So what's ahead and how can we scale those efforts around the globe? Joining me now to discuss is Dr. Judith Monroe of the CDC Foundation. Dr. Judy, thanks so much for joining us on LinkedIn News Live.
Wonderful to join you.
Let's start with the news on the top of the hour here. Johnson & Johnson, their single-dose vaccine getting approved by the FDA. What does that mean for our rollout, particularly here in the US?
Yes, I think the news today is saying that the safety data shows that it's a very safe vaccine. And over the next few days, we anticipate that FDA will approve with the emergency use authorization. What it means for us is it's going to be more vaccine, and we need more vaccine to be available. We know that there's been a high demand in many communities, and the thing about the J&J vaccine is it's a single dose, so that's going to make it less cumbersome. It also doesn't have to be stored at such extreme cold temperatures, and so that makes it easier to manage.
People are really excited about the single dose, and also mentioning this, the storage requirements are much less than the other vaccines that are on the market right now. But how quickly, realistically, can we get this into the market? What are some of the barriers in terms of getting this into, as we were talking about, people's arms at a record speed?
Yeah, so for the J&J vaccine, what my understanding is they're going to have about 20 million doses by the end of March and 100 million by June. And we're seeing both with Moderna and with the Pfizer vaccine that they're ramping up production. They've overcome many of the hurdles that they had. We all have to stop and take, I think, pride and excitement in the fact that we've got a vaccine this fast and so many companies. But there were shortages in raw materials, and then they had to ramp up the production. Many of those are overcome, and now it is the hard work of getting vaccine into the arms of people and getting and having an equitable distribution. In some ways, we've got a paradox because those that have been impacted with the highest morbidity and mortality, our communities of color are the ones that are actually having less vaccine in arms. And so we really need to overcome that. And that's going to take an effort across the country and around the world for that matter.
Let's dive into that a little bit, Judy, around the equitable distribution of the vaccine. It hasn't been equitable. And you know, in terms of the hard work that needs to be done, what's top of mind in terms of cross-functional partnerships that need to be made in order to make the vaccine rollout more equitable?
Yeah. So when you look at the equity so far, I mean, you can unpack it, right? So one of the issues with equity has to do with technology. Some of the being able to actually access and get a scheduled appointment to have a vaccine required being able to go online, make appointments, having iPhones, transportation. I mean, so there are a lot of factors. So that right out of the gate created inequity. Then we have the issue of vaccine hesitancy and folks that are rightfully have concerns about a vaccine, and they have a lot of questions. This vaccine was created really quickly. It's being given free. When you look at some of the historical trauma with communities of color, they rightfully have questions, and that's not a quick fix. It's not a matter of sending someone in and just saying, nope, this is safe and you need to take it. We need to have trusted voices, trusted members of the community that are knowledgeable and are able to actually hear the questions that folks are asking. Folks may have really detailed questions. Is it okay for me to take this vaccine? Because maybe I'm a cancer patient, or maybe I'm undergoing treatment. So this is really what we're calling hyper-local. To overcome this, we've got to get into every community, and we need to mobilize really an army of support.
If you're just joining us here on LinkedIn News Live, I'm here with Dr. Judith Monroe from the CDC Foundation, and we're talking the rollout of the vaccine. So if you have questions about anything to do with that, please let us know in the stream, and we'll have a conversation about that on today's show. Dr. Judith, I think it's probably really refreshing for a lot of people in the stream to hear you, particularly in your position, say that it's okay to have questions, and it's actually welcome to have questions. So when you think about this vaccine hesitancy that we're actually seeing growing right now, particularly here in the US, what's the answer? What's the solve in terms of getting more people comfortable with taking the vaccine?
Yeah, I do think it's the conversations, right? I mean, I think individuals need to be talking to family, friends, their personal physician, those that they have had a relationship with and they know that have their best interest in mind, and then it's got to be based on the actual facts around the production of the vaccine and the safety of it. But I think also, this is all hands on deck. So I think we've got our churches can play a role, the faith community, our community-based organizations. We're doing a lot of work now with community-based organizations to help arm them with the right information and mobilize. And then there's a big role for businesses as well. This is really public-private partnerships. When you look at employers and all their employees and what they might be able to do to help answer the questions and build confidence in vaccines, that's really welcome as well.
And a lot of the work that you're doing at the CDC Foundation is partnering with employers to get the word out about the vaccine. What's going on that front? What is the role of the employer in terms of getting the rollout of the vaccine quicker?
Well, it's a big role, and it's actually multifaceted. So we launched something last week called the Health Action Alliance. This is a partnership between the Robert Wood Johnson Foundation, the Beaumont Foundation, Business Roundtable, the Ad Council, and the CDC Foundation, where we've come in collectively with support to support a group, a social impact group called Media Right, to be able to pull together information for businesses. So we went live last week with the website. It's quite remarkable, the resources already on that website for businesses, all the way from like letters that a CEO might send to their employees, what the HR department might need to do. And then it just goes on and on, but there's also information on there about what businesses are doing that are kind of bright spots and innovations to help with vaccines. So businesses can, we have some businesses that are sites for vaccines. Walmart is opening up. They're going to have a number of locations for folks to be able to get their vaccine, particularly in rural communities. That's an area that many times is forgotten, and that has special needs and a lot of questions from folks that live in rural communities. Starbucks is doing a lot of work. There's JP Morgan Chase has partnered with Lyft and other partners to be able to give free rides. I think they're doing 60 million free rides for folks to be able to actually go and get the vaccine. So I think employers, it's really exciting to see the multiple things that they're standing up to help with this effort.
But on the topic specifically of employers educating actual employees about how and where to get the vaccine, this is uncharted territory for most employers, Dr. Judith. And in many cases, they're making health decisions in some cases for their employees. When you talk to organizations like the Business Roundtable, what are their questions? What are their top concerns in terms of how their role is pivoting in this pandemic?
Yeah, no, I think folks are asking a lot of questions. And I think when you, when you think about, and I know the question of the day is whether or not an employer should mandate that vaccine be given. We've seen that roll out with hospitals, with influenza vaccines. That's been tested in the medical world in the past about whether employees should do that. I believe there's the role for businesses is getting the correct information, making sure people have their questions answered. I can't emphasize that enough. And then making it really easy for folks. We've got some businesses that actually are paying. They're giving maybe 4 hours of paid time to assure that people can get their vaccine. So making it, we talk about this in public health a lot, making the healthy choice the easy choice is a principle that I think all businesses can apply as they think about their individual businesses.
Well, Dr. Judith, I'm going to go ahead and bring back the poll that we have for the members in the stream today to get their take on what we're discussing. Should employees be required to take a COVID-19 vaccine before returning to the office? We want to hear from you. A, yes, B, no, or C, it depends. Vote, but also let us know your thoughts behind your vote, and we'll reveal the results of the poll at the end of today's show. Dr. Judith, this gets to the big hairy topic for employers as they're approaching the summer and looking into the fall, which is reopening, offices reopening. A lot of employers aren't there yet, but it's on the horizon and they're having to make critical decisions now to get there. What are you hearing on that front? What are the top concerns? What are employers thinking about right now?
Yeah, no, I think all employers are taking a hard look at what they can do. And one thing I would emphasize to everyone listening in today is the vaccines are exciting, and we need, we want to make sure that everyone that is confident getting a vaccine will have access and be able to get that vaccine. But on the other hand, we all are going to still be wearing masks, and we need ventilation matters in a work site, as an example. We also still need testing. There's not enough testing taking place now with the new variants that are circulating. We want the vaccine quickly to help mitigate and prevent more variants being developed or occurring. But at the same time, we've got to make sure that people are getting their testing so that we know what's happening in the communities, and you can quarantine or isolate if you have an employee that in fact does become infected. So I think for the employee, as we begin to see more and more vaccine over the summer, they're saying by summer, every adult in the U.S. that wishes to have a vaccine, there should be enough supply. So I think a lot of businesses are looking toward the fall that we can begin to really get back to normal. But those that are already open, we've got there are businesses that are in business right now. I just really encourage everybody to wear the mask, wear them correctly. CDC just came out with, they're standardizing the cloth mask so that you've got much more detailed information about how to wear the mask. And then, of course, the hand hygiene and the distancing and the ventilation are all just as important as the vaccine for a while.
Well, Dr. Judith, you mentioned masks, which for me, it's just like putting on my shoes when I walk out of the house now, but there still is a fair amount of mask hesitancy across the country. I read yesterday that President Biden is considering sending masks directly to people's homes in order to quell some of this. Where are we on that front? Have we evolved since the beginning of the crisis? Because it doesn't seem like there's been a lot of movement in terms of those who still think, hey, I don't need a mask.
Yeah, if you look to other countries, and this is an area that we can learn from other countries, those countries that either put a mask mandate in or really encourage masks early on, they did really well. I mean, they those that applied those efforts fared better than us. And the problem is, if folks are not wearing masks, we're just allowing more virus to circulate. And the more that's out there, the harder it is to obviously control this. And 500,000 deaths in our country is incredibly sad and serious. And so we need everybody, again, this is a little bit like the vaccine, trust in the vaccines. We need folks to talk to their family, their friends, their employees, role model. I talk a lot about, leaders need to model the way, and we need everybody just to wear their masks. And it's sad that we haven't done better.
You mentioned countries where there was a universal mandate. The US is certainly not one, at least yet, that has done any of that. Dr. Judith, I want to go back to your early career. You actually spent your early career working with families in rural areas. Is there anything that you learned from those early days in your career that can be applied to your work now?
Oh, yes. I spent 4 years practicing in the mountains of Tennessee early in my career. And I will tell you the first thing was humility. I learned more from the patients that came to me than I think I imparted knowledge to them. I learned that we do need to have empathy, and we need just take time to listen. There's a lot of wisdom in communities. There's so much wisdom and knowledge, and just taking time to listen and partner makes a big difference. Happy to say, I saw a lot of patients over the years when I practiced in the mountains, that once we had that trust, and trust is huge, and trust is important for the patient-doctor relationship, but it's so important as well in like a pandemic. And we've seen that in some of the other countries as well, where they've really trusted the messenger. The message has been consistent, and folks follow in. So those were two things I learned: is make sure you listen, and then build that trust. And it's amazing what you can do together when you have.
I think those are lessons that apply no matter what profession you're in, Dr. Monroe. I'm going to go ahead and say hello to some members who are joining us in the stream. We have Garrett, Kathy, and Jesse in Texas, Andrea and Tanya from Florida, Mario from California, Belinda in Illinois, and Tomas in Mexico. Thanks for joining us on LinkedIn News Live. And Dr. Monroe, I'm seeing some questions rolling into the stream. Stephanie wants to know, why is the U.S. vaccine rollout so different between states?
Well, welcome to the United States, for starters, because, public health authority actually lies at each state level. I was a state health officer in Indiana, and I learned that lesson really well. The governors and the state health officers actually have the public health authority in the United States, because each state, is basically sovereign. So that's the reason. Each state will make their own decisions, and we've seen this time and again. However, that can be informed by national plans, and how funding goes to the states can help that as well. But that's the reason you see the differences.
But Dr. Monroe, you read these stories in the media, these horror stories, I will call them, of people driving 12 hours to a different state to get a vaccine. And of course, these are people with a lot of means to be able to do this, which gets back to the equity concerns. And just assuming best intentions on a state level, I'm sure that the officials who are in charge of these rollouts want to get the vaccine in people's hands as quickly as possible. What are the barriers? What is going on that is making it so challenging in particular areas?
Yeah, so one of the things that happened with the response is that there was a lot of emphasis on the front end for contact tracing, as you know, of course, getting people to wear masks. This was prior to the vaccine. And our country at large has not invested in public health. So we've got a public health system that already was under-resourced. Now they're being asked to do all the contact tracing. Cases are surging. Hospitals are overflowing. And there wasn't enough, in my opinion, there wasn't enough opportunity and resource to be able to do the micro planning to do the vaccine rollout. And this is what we've all felt. I think our country, we really celebrate research, as we should, and I think we need investments, obviously, in research and academic institutions, but we can't forget the boots on the ground. The actual getting the shot in the arm is a great example of what public health does. It's they're the practitioners. They take the science and the tools and actually on the ground make it happen. So it's very practical. We've not invested enough in that, and I hope we, as a country, take a lesson from this and invest in our public health departments and the health departments being able to have strong partnerships in their communities.
It's almost like the story with everything in the pandemic. We're building the plane as we're flying it almost, and now we're seeing the negative externalities of that. Dr. Monroe, I have another question in the stream from a member who's asking, why do people still need to wear a mask if they're vaccinated?
Yeah, so there's a few reasons for that. First of all, the vaccines, even the ones that, if you get 95% with Pfizer or Moderna, I think it's 94%, you're still not 100% protected against the virus. And so continuing to wear a mask protects you as well. And there's still a lot we need to learn about this, right? We kind of had a global experiment going on with this novel virus. And so we still are learning whether or not, if somebody's been vaccinated, is it possible that maybe they can carry the virus and transmit to others? Would they be maybe asymptomatic? Those types of things. So, and then part of it's the role modeling. I will tell you, I think we just need to all collectively wear our masks. And that way we're protecting our families, we're protecting ourselves and others.
And the world that this member is asking about is one in which the vaccine will be available to the general public, which will happen eventually. You mentioned some of the things that employers are doing now to speed up and expedite the rollout. But as the vaccine becomes available to the general public, how do you see of the role of the employer adapting?
Yeah, I think as we have, let's fast forward to this summer, right, when we begin to have just lots of vaccine. The other thing that's happening, of course, with the vaccine is it will be easier to access the more we continue to have, because it's now being distributed in pharmacies, as an example. We're having mobile vans. I know there's a lot of emphasis on trying to get to those communities. So I think for the employer, once it's available to the entire community, the employer can not only help encourage and support their employees getting the vaccine, but they really should adopt their community. I would ask every employer to think about, where is your influence? Where might you put some resources to help some of that hyper local work? Because it will be, as this rolls out, you're going to have those that still are going to be hesitant and are going to have a lot of questions to answer. And I think employers can play a big role in their communities and managing those hardest hit.
Right. And Dr. Monroe, I'm curious, as a physician who's just been on the front lines of educating and also serving people throughout this pandemic and during the vaccine rollout, what keeps you up at night?
Well, I go back to there are a few things that keep me up at night, but one is the public health infrastructure. We need strong public health in our country. It's been proven over and over again. And I always worry when we don't learn our lessons. My husband used to tell our kids that lessons will be repeated until they're learned. And, we've learned from other outbreaks what we need to do and how to make sure that we have strong surveillance. I worry about our data systems. We really need data modernization. We've got technology now that needs to be across all of our public health system, and that there are efforts underway. CDC is leading a data modernization initiative now. And then, as I think about equity keeps me up. We need health equity. We don't have time and again. And of course, COVID has really put a bright light on the inequity. We've got to overcome that. And I'm very happy to see so much energy and emphasis and people being intentional about taking on equity. And I hope that continues because when we look at climate change, we don't have to, talk about vaccine distribution. Last week, there were 6 million doses or so that got delayed because of the weather events. Climate change, we can't ignore. And that squarely, health equity is a big part of that as well.
Well, on a personal note, Dr. Monroe, my parents' vaccines were actually 2 of the vaccines that were held up, and they were so nervous that they weren't going to get their second dose. And the good news is, this story has a good story, is that on Thursday, they're both getting their second dose, which is great. My mom's an asthmatic and my stepfather is over 65. So we're really happy about that. Dr. Monroe, before I let you go here, we have members joining us in the stream from everywhere from New York to Tunisia to Missouri to Spain to Indonesia. What do you want to leave them with? What do you want them to know about this vaccine, what they can expect in the next year?
Yeah, so I think on the vaccine front, again, what I would leave folks with is let's celebrate science and let's celebrate the fact that we have a safe vaccine. And we must collectively, we didn't talk about the vaccine getting into low and middle income countries, but we need to be global citizens and everybody can help contribute. There's opportunity to help support the rollout of vaccine into the countries at greatest risk. And there are like 160 countries that have not received the first dose of vaccine, so we need to make a difference with that. And then just remember that we're all in this together. This is just an example of how we're all interconnected and need to support one another.
Well, Dr. Monroe, you're a busy lady. I appreciate you joining us on LinkedIn News Live. I certainly learned a lot from our discussion. I can see from the members in the stream, they've learned a lot as well. So thank you so much for joining us.
Great to be with you.
That was Dr. Monroe of the CDC Foundation walking us through what the vaccine rollout will look like for the months to come. All right, I'm curious and can't wait to check in on the poll results that we have for you in the feed today to know what you guys thought about if employees should be required to take a COVID-19 vaccine before returning to the office. Wow. 58% of you said no. We have 33% of you saying yes, and 9% of you are on the fence, maybe having a different look on things after our conversation with Dr. Monroe. I appreciate all of your thoughts in the stream and for voting in the stream today. All right, tomorrow on LinkedIn News Live, I'll be sitting down with film director Lee Daniels to discuss his latest project on Hulu and how we can bring more authentic Black historical figures to the big screen. I'm Caroline Fairchild. Thanks so much for joining us on LinkedIn News Live.